It's 5:30 p.m. here in Seoul. I'm Devin Whiting at the Arirang News Center, and we're breaking into our regular programming to bring you the latest briefing from the South Korean health authorities. That should start any moment, and we'll cut straight to it when it does. In the meantime, South Korea reported 98 new coronavirus cases on Sunday. Of those, 54 are in the southeastern city of Daegu and the surrounding province of Gyeongsang-Bukdo. The country is closely monitoring an increasing number of infected people coming in from abroad, including Europe, the U.S., and South America. The total number of confirmed cases in the country is now at more than 8,800. Let's cut to the briefing and listen in.
And we will also have the other members of the Central Disaster and Safety Countermeasures HQ participating, which includes Tae Ho-yoon. We also have the sign translation provided. The briefing will be provided by Minister Neung-hoo Park, who will be explaining about the countermeasures, and we will have the Q&A session after. First, we will hear from Minister Neung-hoo Park. So I'll start the regular briefing for Central Disaster Safety Countermeasures Headquarters. I am Neung-hoo Park. So today we convened a meeting under the leadership of the Prime Minister, and we talked about the follow-up measures to strengthen social distancing. And we also talked about the measures for the educative institutions and the demand and supply of the face masks. As of March 22nd, as of midnight, the number of new confirmed cases amount to 98, and those who have been discharged has been 297. And until now, there has been a total of 8,897 confirmed cases, and of them, 2,909 has been discharged. And therefore, we have 5,884 people being treated, and we have 104 cases of deaths. So this is the result of carrying out more than 330,000 tests. So we pay our respect to the deceased and the family members. So for the past week, we have seen that the new number of confirmed cases on a daily level has been around 800. So I believe that we are overcoming the crisis. However, we should not be relieved right now. And there is still a risk that we could see further outbreak of COVID-19. In Korea, there are some cases where we cannot actually figure out the path of the outbreak. And in particular, we see the COVID-19 being spread in the group facilities. And across the world, we see that there has been a dramatic increase in confirmed cases in the United States and in Europe. So with the fast spread of COVID-19, we have seen that there has been over 300,000 cases in more than 180 nations. And as a result, in order to contain COVID-19, many companies have been closing, and they have also been monitoring the transportation. So this is an unprecedented measure that we are all taking. And a lot of experts are saying that COVID-19 has spread to a lot of the local communities, and with the outbreak in the rest of the world, it could come back to Korea, so we should not be relieved right now. In churches and in long-term facility cares and in other group facilities, we see cluster outbreak. And during the preventive measures, we also see an increase in the inflow of the infection coming from abroad. So we have to tighten our measures further, and this has been the advice provided by our experts. And we also agree with this advice from the experts, and we will have to strengthen our measures. And we will also have to more closely monitor the long-term care facilities and religious facilities. And we also have to strengthen our preventive measures in terms of those coming from abroad. In the meeting today, we talked about strengthening the social distancing mentioned by Prime Minister yesterday, and we talked about the concrete measures to be taken. And starting on March 21st, the government asked the citizens to participate in the strengthened measures for social distancing. And our citizens has participated actively, and we were able to prevent the fast spread of COVID-19 thanks to all of you. So we see a continuous maintenance of the social distancing, and I understand that our citizens are feeling frustrated. So people are probably frustrated and people are probably tired about until when we have to maintain such a lifestyle. It may be really difficult to actually maintain this for an unlimited period of time. However, we should not be relieved right now, and we should not be going back to normal lifestyles yet. So we have to vitalize ourselves a little more so that we can prevent the outbreak in long-term care facilities and other group facilities. So in this regard, we're going to strengthen the social distancing one step further for 2 weeks. And we're going to cooperate together so that we can prevent this at a level that the medical facilities can handle. So in order to prevent the long-term outbreak, we have to make sure that we have the lifestyle preventive measures so that our facilities can work together. So in order to coordinate and in order to be able to transfer to the life preventive measures, we want to ask you and all of our citizens to participate in the strengthened measures for social distancing. So considering the latent period of COVID-19, we're going to carry this out for 15 days. And we're going to make sure to have early detection of those detected at the early period. And we're going to monitor the group facilities very closely. And for us to succeed, we need the cooperation of our citizens, corporates, and the religious bodies. And it is all the more important. So we want to ask all of our citizens to refrain from going outside for 2 weeks and stay at home if possible. So please stay at home unless you really have to go out, such as commuting to work or buying your basic essentials. And also, please avoid outings, gatherings, or travel, or postpone it. And if you have any fever or if you are coughing, please make sure to stay at home and take sufficient rest. And please make sure to follow the rules on personal hygiene, such as washing hands and following the coughing etiquettes, and also ventilate your houses. And we should also make sure that the corporates also follow these rules. We should have someone responsible for prevention, and we should have these people monitoring the preventive measures in the companies. And we want to ask you to strengthen these measures. What is more important is to make sure that those feeling unwell are not coming to work. Even during work, if there are some symptoms occurring, please make sure that those people can go home right away. Make use of flexible work hours and working at home so that we can have the social distancing being followed. And also refrain from having business trips or having too many meetings. And please make sure to have video calls instead. And after work, please make sure to go home right away without having too many dine-outs. For the next 15 days, in order to prevent the infection spreading in the group facilities, we're also preventing the opening of some businesses. So we'll be preventing the religious facilities and sports facilities and entertainment facilities being operated. And if you really have to, please make sure to firmly follow the measures provided by the Central HQ. And depending on the COVID-19 situation, we could have additional businesses being prevented from operating. So local communities will monitor the operation closely, and if these are violated, then they could be prevented from operating altogether. And if they do not follow the administrative measures, then we will be actually granting fines or penalization, and they might have to pay for the damages because these could be claimed if they were to be violated. So in order to succeed the strengthened social distancing, the government will do its utmost. We will start from the government and the municipal governments to follow these rules. And we will also stop the operation of the public institutions such as museums. And we will also monitor preventive measures in the PC cafes and other areas where we see group clustering. And we will go all out on it. So we are having meetings every day with the Central Disaster and Safety Countermeasures at HQ to monitor these things. And if necessary, we'll come up with additional measures. In order to prevent the inflow of COVID-19 from abroad, we are also strengthening the measures as well. So for everyone who is coming in from abroad, we are applying these special entry measures. And for those with symptoms, we are taking the test during the quarantine phase. And they can only enter when they test negative. And there could be some asymptomatic cases, so we are having these people apply the self-quarantine apps to monitor themselves. However, we are seeing a rapid outbreak of COVID-19 across the world, so there is a higher possibility of COVID-19 coming in from the abroad. And we have seen additional confirmed cases coming in from abroad, and we have seen an increase in these numbers. And many were coming from people entering in from Europe, so we have to prevent these quickly. And therefore, as of midnight of today, for all of the people entering in from Europe, we are taking the test for everyone. And during the quarantine phase, we are making sure that they follow the questionnaire, and based on the presence or absence of fever, we are categorizing those with symptoms and those without symptoms. And for those with symptoms, we are actually testing them in a facility that is separate from those without symptoms. And if they test positive, then depending on the level of severity, they'll be transferred to hospitals or the life treatment centers. And even for those who are tested negatively, then for the Korean nationals and for the foreigners, if they are the long-term residents, then they'll be going into a 14-day self-quarantine. And for the foreigners who are residing in Korea for a short term, we are also actively monitoring them, and we are calling them every day to monitor the progress. And also for countries such as US and other countries, we are also monitoring those who are entering into Korea. So we will closely monitor them, and if necessary, we'll strengthen our preventive measures. So for those who are coming in from places other than Europe, we want to ask you to wear the face mask for 14 days, and also to minimize contact with others, and monitor your progress using the self-quarantine application. Respectful citizens, we are seeing the continuance of the COVID-19 for a long time, so we understand that you must be tired and frustrated. Korea saw a rapid outbreak of COVID-19 centering on Daegu and Gyeongbuk, and without having a coercive measures, we were able to appropriately prevent the further outbreak of COVID-19. And this was thanks to the efforts of our citizens who follow social distancing, and also the efforts of the Daegu and the Gyeongbuk citizens. And it was thanks to your civic awareness. So we want to express our gratitude for such a mature civic awareness, and we want to ask you to continue such effort for some time now. So we want to ask you to console one another and vitalize one another, and follow the strengthened social distancing actively for the next 15 days. So as you have done now, the government, the medical institutions, and the citizens should cooperate together. And if so, we will be able to overcome the crisis that we are facing now. Thank you.
지금부터 질의응답 시간을 갖겠습니다.
And that'll conclude our coverage of this briefing. Stay tuned to Arirang for the latest on the coronavirus outbreak in South Korea. We'll be back at the top of the hour.